aihuwa na a gida yaron ba lafiya laulayi har yaron yanzu watan shi 7 ya zo ya rasu.
Gaskiya ko ni ma sai in ce kai abun nan bare yi ba, amma daga baya matana ba ta da lafiya a lokacin kuma tana da ciki.
So the village health workers scheme was brought in Gombe State to be able to bridge that gap.
The National Strategic Health Development Plan has health service delivery and community participation and ownership as part of its 8 focal areas to deliver a sustainable healthcare system to the citizenry. In 2011, the federal government encouraged all states across the federation to establish primary healthcare development agencies to help drive healthcare services, especially on maternal, newborn and child healthcare. Gombe State has since established its primary healthcare development agency and has swung into action on various healthcare delivery projects. One of such is the maternal, newborn and child health project, spearheaded by the introduction and implementation of the Village Health Workers Scheme. On the 13th of October 2016, the scheme was formally launched by the Executive Governor of Gombe State, His Excellency Alhaji Ibrahim Hassan Dankwambu.
There is no doubt the village health scheme will further strengthen our partnership and elicit intervention for the recruitment, training and deployment of 1,200 community-based village health workers in the state. This event is a testimony of our commitment towards providing qualitative and affordable healthcare services and infrastructure to the good people of Gombe State.
The village health workers are a group of volunteers selected from across 57 wards, that is, 50% of wards in Gombe State that are considered most vulnerable in the 11 local government areas. These volunteers are equipped with the necessary and essential health training and tools to enable them mobilize and encourage pregnant women and new mothers in core rural communities to seek care at the health facilities closest to them.
There's still a significant percentage of our people that don't use health services at the facilities for some reasons. To some, it's because of difficulty in accessing the facility because of distance, or probably because they cannot afford the cost of transportation, of going to and fro to the facilities, or maybe there are some cultural and traditional inhibitions that they don't want to go to the hospitals, or the husbands would not just allow them, or because of their household engagement. So by bringing the village health workforce to the household, we're also improving access at the household level and also linking clients at the household level to the facilities.
The name village health workers in some other countries is being referred to as community health workers. They are in the communities, they are also at the households, working with mothers and newborn at that household level, and also providing some simple management first aid services to mothers, newborn, and also children under 5.
The Gombe Maternal, Newborn and Child Health Care Project is being implemented by the Gombe State Primary Healthcare Development Agency with technical support from Society for Family Health and in collaboration with other development partners. Society for Family Health, SFH, is one of the partners funded by the Bill and Melinda Gates Foundation.
Village Health Worker Scheme was a very welcome idea from the Gombe State Primary Healthcare Development Agency. They liked it, they wanted it. So what we're actually doing was providing them some support, particularly technical support, providing capacity building, supporting supervision to these village health workers, and areas SFH are very well known for. But while doing that, we are only doing that, and we are continuing to do that based on one premise, which is handing this over to the government at the end of the day so that they can run with it. And it becomes a model that other states in Nigeria will replicate and copy.
The principal partner as far as village health worker scheme is concerned is the Society for Primary Health and the Primary Healthcare Development Agency leading. And actually, when we resolved to have the village health worker in Gombe State, and that SFH, the Society for Primary Health, will support us, we had a lot of meetings. One of which, from the beginning, is at Abuja, where officials from BNGF came, and we were sponsored to Abuja. We met with them and discussed the importance of having the village health worker to help Gombe, to bail out Gombe out of the maternal and neonatal morbidity and mortality that is happening in Gombe.
The project is unique because the government conceptualized, designed, and led the intervention, laying solid foundation for sustainability.
This Gombe State Village Health Worker Scheme is a very unique implementation. Very unique because from inception, from the designing stage, sustainability was built in. The implementation is done in collaboration with 4 other grantees. We have Evidence for Action, who are part of the project. We have PACT, we have Communication for Change, and then SFH. And why I said the sustainability was built in from the design is that the government themselves designed what they can do with or without SFH and other grantees as technical support. They agreed on how this training will be done. They agreed on the criteria of the women that they wanted to be on the scheme. They agreed on the duration of the training. They agreed on the style of the training to say this training should be fully residential. And they also agreed on the stipend that should be given to these women to facilitate their movement.
A key strategy employed on the selection and recruitment of volunteers for the Village Health Workers Scheme is that the process sought and involved participation of community leaders and members using the set criteria prescribed by the project.
In identifying women, this was done in partnership with the WDCs, the World Development Committee members, who are a combination of men and women identified by the community people. And they are the last government structure at the world level. So we work with them, and these men liaise with the community leaders and other gatekeepers in the community to fish out women who met this criteria that we were looking for.
What we did in the first place was to go around all the villages to have equal representation so that health facilities and whatever you can think of will be improved in our localities. So we did not select only one community or the other, but we went all around the communities because they are under my domain. So in fact, it was selected based on communal places.
The volunteers must be female, above 15 years of age, and preferably married with the permission of their husbands. Above all, they must be literate with the ability to read and write in English.
So we were looking for 100% female workforce. That was one issue. And this workforce, of course, would have to be in possession of a minimum criteria, a minimum level of education in terms of literacy, that the person must be able to read and write so that she will be trainable, and then she will also be able to pass relevant information to the clients at the household level.
Getting a volunteer that she is known to the community by the community members, that she can speak the dialect and also very friendly to the culture of the community.
After a careful selection process, the scheme engaged the village health workers in an extensive classroom and field training that lasted 3 weeks, 9 days in classroom and 12 days on the field, and covered key maternal and newborn healthcare issues.
The first training that I received was a training about how to identify pregnant women and how to visit them and also give them, provide health talk to them and also refer them to the health facility for ANC visit and for facility delivery. The first training was conducted here at Funakaya local government. Thus, we went for 9 days training, and the second phase was at Gombe. And we went there for 7 days training.
Da farko mun je training a 2016 mun je a Gombe, mun yi kwana 11. Aka koya mana yadda za mu lura da mata masu juna biyu, yadda za su je awo a asibiti da yadda za mu ga matsaloli wanda za su sami yara a can yayin da suna da matsaloli, za mu iya tafiya asibiti tare da su.
The training plan actually started from the design, which was in partnership with the Gombe state government, specifically the primary healthcare agency. They designed this training from the content. They looked at the content of the manual. What will the village health worker learn? They agreed on the content and worked with experts, professional experts in the area of maternal and child health to come up with manual. And then we developed flip charts. Flip charts were pictorial materials which the village health workers could use in turn to communicate at the community levels.
About 1,200 village health workers from the 11 local government areas across the state were trained in phases. The village health workers were then deployed to their respective communities, where they began to conduct home visits to educate pregnant women and nursing mothers on danger signs during pregnancy, essential newborn care, and encouraging their clients to go to the facility before and after delivery. Accessing some of the communities is not easy because of the difficult terrain. Sometimes the journey can take as long as 6 hours. Some communities are located on the hills and down in the valleys. Some are located across rivers. Others become inaccessible once the rains start. Yet, there are village health workers available in each of these locations, ensuring that pregnant women and nursing mothers get the required information and education on the importance of attending antenatal care, getting access to essential maternal, newborn and child health drugs and commodities, delivering in a health facility, and getting the required postnatal check for mother and newborn. In between these hills and valleys lies Sikkim communities in the southern part of Balanga local government area with a population of about 450 people. Among the inhabitants of these scattered communities is Rebecca Joshua, a 52-year-old woman. She is the village health worker for Sikkim and its environs. She makes her weekly rounds in the hilly communities and covers those in the valley as well.
Idan na hau tudu nikan tafi da sanda. Idan na tafi da sanda sai in je in sami dutse in zauna. Idan na zauna na huta, in na sha ruwa kuma sai in kama hanya in tafi. Idan na zo farko na samu mai gidan a gida zan yi sallama. Idan na yi sallama, idan ya ce mai gidan baya nan, na ce to za ta bani zarafi in gaishe ta ko in shiga cikin gidan, sai za ta ce wai in shiga. Idan na shiga sai in gaishe ta. Idan na gaishe ta sai in fara warware abin da ya kawo ni akan mace mai ciki wanda ya fara daga wata 4 zuwa 5 ya kamata ta je awu.
Mercy Peter is also a village health worker at Jauro Barde community in Nafada local government area. It is a long trek for her along the Nafada river bank to the communities where she goes to conduct her home visits, most of them located across the river.
The nature of the job, I'm not getting it easy as of then. But with the help of the work of SFH, there's an improvement for the women to visit their health facility for their ANC. But the main big reason is that women usually complain of this big river. There are no good ways to cross the river and no bridges. So we get it difficult for them to cross from the rivers to the facility.
Even with the challenges associated with crossing and reaching communities in the hinterland, Mercy still makes progress.
I try my best to visit the women 3 times a week to see that I convince them to come for the ANC in the facility. And even with the difficulties, the women are really trying to come to the hospital for their ANC.
The village health worker is not alone on the scheme. There is the supportive component of the interpersonal communication conductors, also referred to as IPCs. They organize discussion sessions to sensitize key home decision makers and influencers, that is, husbands, mothers-in-law, and religious leaders, among others, on the activities of the village health workers and the roles of the influencers in ensuring that pregnant women and nursing mothers practice safe home-based maternal child health life-saving interventions and also access skilled care.
Magana mai akai shine muhimmancin bari mace zuwa asibiti. Muhimmancin bari mace ta je asibiti. Akwai maza da yawa da ba sa bari mata su je asibiti. Da kuma matan da ba sa zuwa asibiti ba san muhimmancin zuwa asibiti ba. Abuwa da yawa suna faruwa asibiti. Muna ganewa ko? To zuwa asibiti a bari mace ta je asibiti akwai muhimmanci sosai.
There are also the ward development committees in the various communities who serve as advisors and internal advocates for their people. They are like support for pressures coming from the communities. If the target community members who have been engaged by the village health workers fail to complete their referral to health facilities, or husbands refuse pregnant wives from seeking care in the health facilities, the ward development committee members are called in to intervene. They also work with the health facilities to ensure that services are available and rendered in the most client-friendly environment.
Da kam in ka faɗa miji zai iya hana matarsa zuwa asibiti to za mu dama ban da yanzu. Yanzu mun shawo kan lamarin albarkacin su ma'aikatan asibiti da ku ƙungiyoyi da kuke kira mu bita kuna wayar da kanmu to a gaskiya abun ya canja muka yanzu anan bamu da wannan matsalan.
Iyaladi is one of the influencers in Nasarawo community in Gombe. A mother of 4 who lives in the same compound with her 4 sons and daughters-in-law and commands a high level of respect in the household.
Kun ga maganan zancen asibitin nan kullum suna mana bayaninsa. To mun ga kuma ƙayatarwansa mun ga kuma amfaninsa. Shine nake cewa ku kokarta ku dinga zuwa awo, kuna zuwa awo, ku dinga kuma fahimtan abin da za a gaya muku a wajen awo. Saboda mu ma wataran za su tambaye mu. Yawa in kun aihu kuma dan dinga tsananta muku ku dinga kaiwa yara rigakafi.
The Village Health Workers Scheme has succeeded in motivating Iyaladi to frequently engage in discussions with her daughters-in-law on maternal and childbirth issues. She gives advice and ensures they visit the health facility as the need arises. Amina Abdullahi is one of Iya's daughters-in-law. She has 7 children, but only the youngest was delivered in a health facility. Amina experienced various degrees of complications during pregnancy and childbirths for her 6 older children.
Tana mana bayani kan mun je abu ya dame mu dai mu dinga zuwa asibiti ko saboda zai kasance kare ja mana wani matsala. Muna zuwa daidai iya gwargwaron mu ko muna samu mun je mu ba abin da yake ja mana matsalan komai.
Abdullahi, Amina's husband, also accepts the ignorance of the past and appreciates the new trend in maternal and childbirth issues.
Da muna da ba ma kaiwa awun nan da ta zauna ta mana bayani sai muka koma muna bayar muna ba su shawara suna zuwa awu muna tura su. To a cikin turawan da lalle muka ga fa'idan turawan saboda da wasu laulayi da ake yawan samu to sakamakon mun koma turawa asibitin sai muka zo muka samu wannan laulayi ya kau ba a samu sai yanzu.
Amina Abdul Mumini, popularly known as Hajiya Mama, is a former traditional birth attendant. She is highly respected within and around Buba Shangu community in Gombe local government area. Among the women fold, her suggestions and instructions are strictly adhered to. She is an influencer to the core and serves as a sure support to the work of the village health workers in her community.
Amma a gaskiya waɗannan yara da suka zo suka fara zuwa gidan mai anguwa ya neme ni na ji maganan su yaran suka zo har gidana nan suna zuwa sun zo da wasu takardu suka min bayani to duk inda mace mai ciki yake na karbi nambanta wata yarinya ana ce mata Kubura na karbi nambanta duk macen da naga tana da ciki nakan nemi attention ɗinta ta zo ta bada takarda don irin dan booklet din ma wani lokaci nakan je gidajen matan ma in karba in tabbatar da cewa suna zuwa asibitin.
Through her influence and advocacy, Hajiya Mama was able to refer many expectant mothers to the facility for delivery. Aminu Umar and his wife are beneficiaries of Hajiya Mama's efforts.
To alhamdulillah akwai wannan bayar Allah tana shigowa sai muna ga abin kamar da kauyanci ne ma. To tana shigowa tana dan wayar da hankali a hankali tana gaya wa mata cewa ya kamata in a dinga zuwa asibiti ana duba lafiya da sauransu. Sai muna gani abin kamar wani iri. To da ta so ta sake kan samu mu mazaje masu gida takan ba mu shawara ya kamata mu dinga sa matan mu suna zuwa asibiti. To sai muka dauki shawara nata muka ce bari mu gwada mu ga abubuwan ke tafiya. To alhamdulillah ni dauki shawaran ta nakan tsawatarwa mata cewa a je asibiti ko da lokacin bai yi ba nakan tuna cewa lokacin zuwa asibitin nan kan yayi ne ya kamata ku dinga zuwa asibitin nan fa saboda shawarwarin da ake bayarwa.
Tana gaya mana cewa mu je mu asibiti kuma mun yi kokarin zuwa asibiti mun ga abubuwan nan sun kankama sun yi kyau gaskiya mun gode.
One of the major challenges in accessing health facility services, especially in the hard-to-reach communities, is timely transportation to convey expectant mothers and newborns. The Emergency Transport Scheme, that is ETS, includes volunteer drivers that are members of the National Union of Road Transport Workers and non-commercial transport owners who are vehicle and motorcycle riders in the community that were trained by the project on how to lift pregnant women in cases of emergencies and newborns with complications. Their goal is to ensure that all emergency cases get to the health facility safely and on time. An example of the synergy that exists between the village health workers and the Emergency Transport Scheme and community transport volunteers is seen between Amina, a village health worker, her client Ralia, and the Emergency Transport Scheme volunteer in their community, Malan Yakubu. Amina is the village health worker at Angwanyobi community in Funakaya local government area. She goes from house to house to identify pregnant women and conduct her home visit.
Kwanaki na zo na miki bayani akan muhimmancin zuwa asibiti sau 4 kafin haihuwa ko ana so akalla mace ta je asibiti sau 4 kafin ta haihu ko ba haka ba sannan na miki bayani akan amfanin wannan IPT dose wato maganin zazzabin cizon sauro wanda ake bayarwa.
2 months later, Ralia is due for delivery.
Hello. Baban Abubakar za ka samu zuwa ka kai ni asibiti ne na fara naƙudan. Ba za ka samu zuwa ba. To bari in kira Ingozo man namu ta zo ta kai ni.
Salamu alaikum. Mama Abubakar, naƙudan ne? Lallai to an shirya kayan kuwa? Me gidan naki fa kin faɗa mishi? To bari in kira motar taimakon gaggawan namu.
Amina arrived at Ralia's house and noticed that she was going into labor. As a trained health worker, she immediately moved into action by calling the emergency transport volunteer Malan Yakubu. Together, Amina and Yakubu helped the pregnant woman to the health facility.
Idan mata ta zo haihuwa sai aka ce mana haihuwan ya gagara, mukan tashi take mu ɗauki mota mu je mu ɗauke ta mu kai ta, in akwai maternity kusa da mu mukan kai ta maternity ɗin. Idan muka je likitoci suka karɓe mu domin muna da uniform, in mun je suka ga uniform namu sukan karɓe ta da wuri su sa taimako a ciki nasu.
To support the emergency transport scheme, there is also the community transport volunteers. This group of volunteers who are not into commercial transportation use their motorcycles or vehicles to transport women and newborns to the health facility.
Akwai lambobin wayanmu wanda aka raba a asibitoci wadda in ya kasance kowane lokaci komin dare ana kira, in an kira mukan zo mu dauki mata ko kananan yara wadda aka haihu suke da damuwa ko mata masu juna biyu wadda ba su da abun hawan da zai kai su asibiti domin mu kai su asibiti a ceci rayuwarsu.
Supervision is fundamental to the village health workers scheme as it helps to ensure that all the components that make up the program are working to achieve the desired result. There are various schedules to supervision.
We demarcated their wards, their community of work into 4. This week, this village health worker is going to be in so-so community. So I know I have all the maps. From every week, all of my supervision, I check the map and then go to so-so community to see such a village health worker.
When we're coming for this supervision, me and village MCH, MCH and then the community CHU, in order to supervise, we spend a lot of time towards coming to this place. And when we do, we try to utilize that opportunity as much as possible to go and visit all the pregnant women around and then make sure they get the correct messages and then make sure they're doing the right thing to the newborn child.
Data collection and processing is an integral part of the Village Health Workers Scheme. This is a monthly activity that involves all village health workers in each local government area, the program officer in charge of the local government health personnel, the ward development committee leader, and the IPC conductors.
All the names of the village health workers are here and all the indicators, the activities they conducted. We total the activity. So after totaling the activity now, we look at the indicators and discuss it one by one with the village health workers.
The importance of data gathering cannot be overemphasized. Apart from its statistical significance, it also provides information on compliance and defaulters. This helps program management to track, monitor, and make program decisions to help achieve project objectives.
If there are any challenges, at least we will now take it and then take action on it, or we'll discuss it with both the staff of the SFH, the village health work, and then the WDs, that is Ward Development Committee Chairman. We usually discuss with them and see how we can overcome that challenge.
At the health facilities, Society for Family Health ensures that important commodities are available to help in the delivery process as well as assist the new mothers.
Before the VHW scheme, the facilities never had supply of some life-saving interventions, like the clean delivery kits, like chlorhexidine and some other commodities and drugs that we agreed with Gombe State government to supply.
If they have their card, when they come for hospital delivery, we have clean delivery kit which is free of charge. We used to give to the women and it's used as a motivator to other women. So because of that, so many women are coming through the BHW.
To drive home the message of maternal and child health to the core communities, the Village Health Workers Scheme has a media sensitization component to it in collaboration with the BBC Media Action.
BBC Media Action basically delivered the mass media component of the project in Gombe State. We did this through production of programs. So we produced Yatekine Arewa, which is a 30-minute radio magazine program, a weekly program. We produced 60 episodes of the program. We produced 14 public service announcements, that's radio PSAs.
BBC Media Action also trains broadcast media practitioners on program packaging. Suida Mustafa works with Progress FM station in Gombe. Trained by BBC Media Action, she spoke about how the training has enhanced her production.
There was a lady that I met. She came to visit my neighbor. She was asking me, are you the presenter of the program Life Here Kajaranka? I said yes. She said yes. She listened to the program. She always listened to the program, and she's very happy that she learned a lot. Before that program, she don't care about going to the hospital and give birth in the hospital. But after the program, she used to go to the hospital for antenatal, and she gave birth there, and she's taking her child for immunization.
Even though the Village Health Worker Program is based on the principle of volunteerism, the Gombe State Government, through the State Primary Healthcare Development Agency, is motivating the village health workers with a monthly stipend to encourage them.
At the level of the agency, not the state, we are trying to come up with facts that we will convince the state that, yeah, these people are working and they have helped in the improvement of the indicators of Gombe State, so that we will have some recommendation anyway for the state to see how we will actually continue maintaining them.
This particular program, based on the work we're doing with the state is very much a part of the program. And in fact, the state is currently has started funding its own aspect of the program through the stipends that it's providing to the village health workers. Now that's probably, I won't say a first, but probably very fairly unusual within Nigeria, where a lot of programs are actually funded from the beginning to the end by the donors.
The trend in data collected so far indicates a positive behavioral change amongst pregnant women and new mothers.
To da mun dauki asibiti yana da muhimmanci ba mu damu da zuwan shi ba, amma zuwan da take kawo min ziyara ina jin dadin shi. Ina zuwa awu asibiti ina jin dadi. Daga zuwa wata daya na fara zuwa awu har zuwa wata 9. Aihuwa na shi da wannan na 7. Bambancin su idan na haihu a gida yara na suna yawan laulayi. Muna aihuwa da yaro yayi kwana 3 sannan a bashi nono sai a ce a ta bashi ruwa. To yanzu bambancin shi aihuwan asibiti na gane bambancin shi. Kana aihuwa da a ce a dauki yaro a sa mishi nono a baki. To ba shi ruwa har wata 6. To gashi dai yanzu watan mu 1 ne kuma na ga bambanci yanzu yaro na kaman yayi wata 4.
Total number of antenatal facility visits between April to September 2017 stands at 19,761, as against 13,100 recorded between April to September 2016. That is an increase of 50.85%. Total number of postnatal facility visit by clients as at September 2016 was 2,616. By September 2017, it moved up to 5,895. That is an increase of 125.34%. Total deliveries in the health facility from April to September 2016 stood at 5,226, while in 2017, 11,564 was recorded. That is an increase of 121.28%.
Abun da ya zo ya same ka har gida gidan ma kuma a tsanake, matar ma kuma da za ta je ba baƙuwa ba wacce aka sani in yarenta ne yaren da ita mata mai cikin ita take ji ita wannan ma ita shine take yi. To daga wurin ba a samun saɓani wajen faɗakarwa ko kuma wani abu. In dace da fulatanci ma za ta yi mata za ta wayar mata da kai, kuma za ta je ta same ta har gida, ta zo ta gaya mata cewa ga yanda za ta yi kuma ta kama hanyar ta tafi asibiti. To a gaskiya wannan ba ƙaramin murna muka ji ba, ba ƙaramin daɗi muka ji ba, kuma ba ƙaramin ci gaba wannan lamari ya kawo ba.
This program is one of the most influential program we have ever had in this community, because it has transformed the life of many people here. We have had a series of changes both in maternity rate and in healthcare system.
Indeed, the Village Health Workers Scheme has come to stay. In just 1 year of its operations in Gombe State, the scheme has seen tremendous improvement in health facility delivery.